Hey everybody, this is Dr. Nathan Klein with Eye Surgeons and Consultants. Today I'm going to just quickly talk to you about a couple of things with glasses and why the quality really matters if you want your glasses to work well with you. People ask me all the time, glasses, they range so much. What's the difference? I tell everyone there's a few things you always have to consider when you're buying a pair of glasses. First thing we always think about whenever getting new glasses is the frame. We got different frames. If you went and looked for frames, there's at least a million frames on the market. Way more than that probably. So what makes one different or better than the others? Sometimes we buy glasses for functionality. Just observe. These are functional glasses. Are they the most fashionable? Not always, but definitely functional. Otherwise, we have other glasses which are made with excellent materials. The acetate that's put in, these are just a beautiful Maximera frame, and you can see they are built really well and strong. And here's a similar Jimmy Choo with a little bling. These are going to be sitting on your face probably 16 hours a day, maybe for 6 months, maybe for a year, even longer for a lot of people. So we want to make sure that all the materials that went in are built strong. We don't want the screws popping out. Some of them can't, such as this one. They're all built and the spring hinges are stronger. And that's the reason why the frame has to be quality, because we want it to be, again, strong, durable, and hopefully also fashionable, because that's what's going to help. Next thing when buying the glasses, obviously we got the lenses. You got the lenses that go inside. That's the part we actually see out of. So when we're buying the lenses, we have to consider what's going to work best for us. Sometimes we have very small prescription. We can use a plastic lens and that works great. Let's say a kid or somebody that knows they're going to need a more durable lens. We have different options, polycarbonate or Trivex. Those are going to be shatterproof materials that are noticeably thinner than plastic, so they won't be all thick to the side. Many of us have very, very high prescriptions, and we definitely don't want them to be hugely thick Coke bottles. So there's higher index lenses that are going to make them even thinner. So that's definitely what we have to think, because you don't want it to hurt your nose, you don't want it to be too thick, and you want to be able to wear them and be happy with them. After choosing the lens material, we have to go to the finishes. They put on coatings onto glasses. We've all heard of something called an anti-glare coating, and those have changed so much over time. Back in the day, I remember my dad's an optician in Toronto. He's owned glasses stores there for over 30 years, Focus Optical Labs, and I've grown up with this stuff. I remember when these anti-glare coatings came out. They were working, but they would get dirty all day, every day. A lot of companies are still using that 25-year-old material. The newer, better materials, the better coatings, such as, let's say, a Crizal coating, it's going to reduce all the glare, it's going to reduce the smudges, it's going to reduce the scratches. Some of the versions reduce the blue light coming off of the computers, and they're just going to last much, much longer, and you're not going to find yourself cleaning your glasses all day, every day, which is a great, great feature. That's going to help us drive at night. That's going to help us look at our cell phones and computers more comfortably, because we care about comfortable vision. After that little side point, there are a lot of people that are switching from single vision lenses to something called a progressive lens. Progressive lenses have different vision spots in there, different focuses in there. You can see your distance, you can see your up close cell phone or computer, you can see everything in between. Those come in different levels. We have our, let's call them traditional versions of progressive lenses. Those are going to have very little usable vision. If I was going to show you this, right down the middle, maybe you have a little small area of clear vision. The newer, better digitally surfaced lenses, they're going to be much, much bigger. You're going to be able to use almost the whole lens to see clear and comfortable. In office, we usually tell people the differences is like with one, you're driving down a little 2-lane highway. With the newer, better ones, it's like a 6-lane mega highway. That has to deal with most of the things of glasses. That's why quality always matters, because we want to Make sure that you're always seeing clear and comfortable. This is Dr. Nathan Klein, Eye Surgeons and Consultants. See you next time. And check out my tie. It does have glasses on it and the cufflinks.